Thank you, Mr. President. Colleagues, on my desk today, I have a bill that would implement public policy that has been proven to reduce maternal mortality and morbidity rates. The U.S. has the highest rate of maternal mortality in the industrialized world, just behind Russia. And Michigan is at the bottom half of our states. An even grimmer reality emerges when you take into account our mortality disparities between white mothers and mothers of color. Black, American Indian, and Alaskan Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. This is unacceptable, especially because we have the ability to do something about it. The death of a woman during a pregnancy, at delivery, or after delivery is a tragedy for her family and for society as a whole. The death of a mother affects the whole family and our communities in countless ways. Every day in our country, more than 135 expectant and new mothers, or roughly 50,000 women a year, according to the Centers for Disease Control and Prevention, endure dangerous and life-threatening complications that often leave them wounded, weakened, traumatized, financially devastated, unable to bear more children, or searching in vain for answers about what went wrong. These complications are also a strong factor in a mother's decision whether or not to have more children. If COVID-19 has taught us anything, it's how much we need parents operating at the top of their game. And while it's always true that we must spend every healthcare dollar in smart ways that maximize the value of preventive care, the current budget crisis makes it even more imperative than ever. There is strong evidence that pregnancy-related public health spending improves maternal health outcomes and narrows Black and white outcome disparities. Study after study tells us that we have tools at our disposal to reduce those numbers because 2 out of 3 pregnancy-related deaths are determined to be preventable. My bill extends the pregnancy-related Medicaid program from 60 days to a year postpartum, ensuring the cost of obtaining needed care will not prevent new mothers from accessing it during this critical time. Preventive treatment and access to postpartum care are significantly less expensive than emergency postpartum care. Policymakers in at least 6 states, California, Illinois, Missouri, New Jersey, South Carolina, and Tennessee, understand this and are trying to change their outcomes by extending Medicaid coverage to a full year after delivery. And health agencies in Georgia, Texas, Utah, and Washington are recommending similar initiatives. Here in Michigan, we should be doing the same. Gaps in insurance coverage should never be the reason a woman dies a preventable death after the birth of a child. Extending the duration of pregnancy-related Medicaid ensures continuity of health care for women postpartum for medical concerns arising from pregnancy and can avoid costly and sometimes fatal complications. It reduces the stress of finding new insurance, changing providers, or navigating financial hurdles. It supports ongoing behavioral health and substance use disorder treatment to keep moms healthy and engaged in parenting, which is so important since we know that postpartum depression can show up at any time in the first 12 months after delivery. Extending coverage allows women to maintain their health and focus on their families, and make plans to return to work or school. And finally, it promotes healthy development for babies and for all the children in the household. We should not be adding to the long list of reasons women do not seek medical treatment for postpartum complications, and no child should lose their mother because of lack of access to health care. While emergency measures have been put in place during this pandemic to keep mothers enrolled in pregnancy-related Medicaid, we should take this opportunity to make permanent this extension of coverage that so clearly has the benefit of saving lives. I invite your co-sponsorship of this legislation, and I thank you, Mr. Lieutenant Governor, and I ask that my remarks be printed in the Journal.